Hi, what if I tell you there's a simple yet powerful way to tackle the questions in OET Listening Part A? Yes, it is called as APT Technique, Analyze, Predict and Track. Let's find out how it works. Now, before understanding the technique of APT, we need to understand what Listening Part A is all about. So let's understand that. In Listening Part A, what basically happens is you hear healthcare consultation. That is, a healthcare professional will be communicating or talking to a patient. We also need to understand the format of Listening Part A. So when it comes to the format, what you hear is you'll be hearing two audio recordings in Part A. Both of these are healthcare consultations, where you hear conversation between a healthcare professional and a patient. And you also need to understand that these two audio recordings are independent of one another. So one audio recording will be based on one consultation between a healthcare professional and a patient, and the other one is not a continuation of the first one, it's totally a different one. Okay, so you'll hear two such audio recordings in Part A. Now, the next thing that you need to understand is that the duration of each of these audio recording is about 4 to 5 minutes, and you'll have 12 questions to attempt from each or based on each of the audio recording that you hear. So you'll be hearing two audio recordings, and based on each audio recording, you'll have to attempt 12 different questions. And what kind of questions you'll have to attempt? It is called as note completion. Now, what do we mean by note completion is that usually when a healthcare professional has a consultation, or when a patient has a consultation with a healthcare professional, they make notes. They collect information from the patient and they make notes. So this note will be given in the question booklet. I'll show you how it appears. This is a sample note, and you can see some of the information are unfilled and some are complete. So the question booklet will have questions in this format. And what you need to do is that as the audio plays, you'll have to listen, understand the audio and fill in these blanks. Okay, now let's see how are we going to fill in these gaps. Okay, now we have to complete these gaps with a word or a short phrase. Now, with a word means with a single word, or a short phrase. Now, what do we mean by a short phrase? Short phrase means maximum 2 or 3 words. Okay, and we have to complete these gaps with a word or a short phrase from the audio. From the audio, what do you mean by that is, when you hear something from the audio and you feel that that is the answer, you should be using the same word to fill in the gaps. Meaning to say that you should not be using a synonym or a paraphrased version of what you hear from the audio. It should be transferred onto the answer or the question booklet as such. Okay. Now, the next thing is, you might have understood by now, that is, while doing your listening, you'll have to listen to the audio, you have to read the question and understand it, and you have to write down the answers. It's multitasking. So how are we going to do this? Here is where this technique of APT comes in handy. Now, there are certain things that we need to do in prior before we actually start, or before the listening audio starts. One thing that we need to understand is that since this is a consultation, that is a conversation between a healthcare professional and a patient, wherein the patient will be collecting details from the patient, then in such a situation, we need to understand that majority of the answers would be coming from the patient, because the healthcare professional would be asking questions to the patient regarding his condition, symptoms, when the symptoms started, any relevant medical history, for all of which the patient would be giving out answers. So we need to keep this in mind, that the majority of the answers would be coming from the patient. Then you need to know that before the actual audio start to play, you will be getting 30 seconds to analyze and predict. Now, what do you mean by analyze and predict? You can see the questions on the question booklet here. Now, during the 30 seconds before the actual audio starts, you should be going through these questions and understand what all are contained here. So, for example, now here I show a small portion from one extract of listening part A, the first point or the first note says that skin on Daniel's hand is both. So you understand that some symptom is expected here. Then you can see something talking, you can see a point regarding pain. Then it is given no itching and scratching. So there are certain points given here. So you have to go through the questions and understand what all are contained here. And wherever possible, you can or you should be predicting or anticipating what type of answers that you can expect in these blank spaces or gaps. That is what you mean by analyze and predict. How do we do that? I'll show you in a while. Then what you need to do is that, now if you look at this questions, you can see certain headings. So these headings, like for instance, description of physical complaint, treatments, there are certain headings, and like we have keywords. Now what do we mean by keywords? Keywords are certain words which will actually help us in reaching the answer. For instance, in the first point, skin, hands, then in the second point, pain. All these are keywords. So using these headings and these keywords, you should be tracking the audio. That is, we'll understand where the audio has reached based on these keywords and headings. So that is how this works. So during the 30 seconds of reading time, you should be going through the questions. You have to analyze what are the things given there, and if possible, make or you can anticipate what type of answers you can expect in these blanks, and make a note of the keywords so that once the audio begins, you can track the audio. Okay. Now, and another thing that you should understand is that the use of synonymous language. What do you mean by synonyms? That is, synonyms are words, different words which have the same meaning. So you should also be open to synonyms while doing your listening. That is, you might be seeing certain words in the question booklet, but you should not, or it is not right to expect the same word to be heard in the audio. Rather, you will not be hearing the same word in the audio. Mostly you will be hearing synonyms. So you should be open to synonyms. For example, for instance, you can see here, occasionally accompanied by. It's not necessary that you have to hear the word occasionally in the audio. It may be sometimes. So you should be prepared for that as well. So there are certain things that you should be knowing before the listening audio starts. Preparing yourself to listen to the audio is the first thing. So during the 30 seconds which you get before the audio begins, you have to analyze, understand the question, wherever possible make predictions, understand the keywords, and also bear in mind that you will be hearing synonyms of these underlined words in the audio. Now let's analyze this. Now the first section, description of physical complaint. The first note says that skin on Daniel's hands is both, and a gap is given here. So what can we expect in this blank? Now, since it is the physical complaint which is reported by the patient, it should be a complaint or a symptom, skin related symptom, because we understand that skin on Daniel's hands. So what we can expect here is some skin related symptom. Then another thing is that, did you notice this word both here? Skin on Daniel's hands is both. So what we should be looking out for? We should expect two symptoms to be heard from the audio. Now, when we talk about skin related symptoms, what are the different skin related symptoms that we can think of? If it appears in your mind or if it just comes to your mind, well and good. For instance, rough, dry, cracked, bleeding, red, itchy. All these are some of the common skin related symptoms. Now, we should be, once we listen to the audio, we have to look out whether any of these symptoms appear or it might be something different from these. Then one thing that I would like to say is that here I have mentioned a symptom, itchy. But itchy cannot come here in this situation, because if you look through the notes in this section, you find a point that the patient, when talking about the complaint, the patient has already reported that there is no itching For that reason, itchy, we should be sure that itchy will not come as a symptom. So the one thing that you need to understand is that you'll be hearing skin related symptoms and you have to watch out for, or you have to listen to two symptoms because the word both is mentioned here. So it can be something like skin on Daniel's hand is both rough and dry, or cracked and bleeding, or rough and cracked. We don't know what we might hear in the audio. Then moving on to the next point, Daniel's pain. Daniel's pain is described as. So what we can expect here is the patient might be explaining about describing the pain, using a word to describe the pain, an adjective to describe pain, as in intense pain or mild pain, sharp pain, or persistent pain. Persistent as in it is constant, then intense means very sharp pain, or mild. So we should be looking out for a word which show the intensity of the pain. That is what we are expected to hear in this blank. Then the next point is already, we don't have a gap here, it is already given. Then the third question, occasionally accompanied by dash. So here what we can expect is, again, any medical condition or any symptom, again a skin related symptom can be heard here as, that is what we are expecting or anticipating, any symptom occasionally accompanied by another symptom as well. Then the fourth question talks about what? Daniel's condition began. So it talks about when did this problem start. So what can we expect here? It can be a time period, as in it started, Daniel's condition began last week or last month, or it can be something like a season, last summer, last winter, or it can be a specific month like last January, last December. So this is what we are expecting here. So depending on what the words are there in the question, we are framing our mind for certain types of answers. And the last point is already given, Daniel's symptoms worsened by hand washing. So we have predicted some of the possible answers or types of answers that might be appearing in this blank. And one more thing that you have to keep in mind is that it's not necessary that you will be hearing the same words as you see in the question booklet in the audio. You should be expecting synonyms like occasionally, maybe, or accompanied. Instead of accompanied, they might say along with. Then instead of began, they might say something like started. So we should be prepared for that as well. Then like the next point, we have moved on to a different heading, treatments already tried. So when you hear the word treatment in the audio, you have to understand that the audio has reached this section of the question booklet. So we need to shift our focus to this area under treatments when you hear the word treatment in the audio. Now under this, okay, they're already talking about the over-the-counter remedies. Okay, they're talking about home remedies. This home remedy is again a keyword. Then wearing silk gloves at night. Okay, that also is keyword. Treating with. So treating with, what can come in this blank? Treating with. So what we should be expecting in that blank? The entire section talks about home remedies. So what we can expect here is that a home remedy which the patient is currently on. So we can expect a noun there, noun as in a substance that the patient is trying, or it can be a method, substance as in some home remedies like coconut oil or aloe vera, turmeric, or it can be a method like cold compress or massage. That is something that we're expecting here because it's a home remedy. Then the sixth question again, uses his sisters. So uses his sisters dash. What does he use for this condition, skin condition? It can be a skincare product or it can be a medicine. We don't know. It can something like a moisturizer, an ointment. We don't know. Something of that sort. That is what we are expecting from the audio. Now, once we have predicted, we have understood the question, we have analyzed, we have gone through the questions during the 30 seconds of time. We'll be doing this quickly. Understand what are the keywords, what are the blanks looking for, and what type of answers can we predict or expect in these blanks that we have done. Now, the actual audio starts to play, and then we'll find out how much the answers are matching. Okay?
Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for extract 1. Extract 1, questions 1 to 12. You hear a paediatrician talking to the mother of a 6-year-old boy called Daniel. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Mr. Lemmings, come in, please. I believe you're here to see me about your son, Daniel?
Yes, he's 6 years old now, but I wanted to talk to you without him being here, at first, anyway.
Yes, of course. So, tell me, what seems to be the problem?
Well, it's his hands. They're in really bad shape. It's mainly the skin, the way it looks. It's so cracked and dry. He's reluctant to complain about it, but I've managed to get him to tell me that it does hurt. From what he says, I believe the pain is pretty much constant.
Right. Is this accompanied by any other symptoms?
Well, yes. Although there's no itching or anything like that, I mean, I've never seen him scratching them, but the most worrying thing is that there's even bleeding sometimes.
Right.
I don't understand how they got so bad.
So, when did this all begin?
Oh, it's been months now. I thought it'd clear up in the spring when the weather got warm, 'cause I initially put it down to that particularly cold weather we had last winter. I mean, 'cause that's when we first noticed it. But obviously I was wrong. I've tried to pin down what sets it off, and the thing I keep coming back to is all the hand washing. It makes it worse. Now, I've tried to stop him, but it just upsets him if he can't do it, so we've kind of given up.
Have you tried any treatments?
Oh yes, we started with creams for dry skin. You know, just about every remedy you can buy over the counter. And they all helped a bit, but not much. Once we'd exhausted all those options, we moved on to the home remedies from the internet. I read about things like getting him to wear silk gloves at night. Let me tell you, they weren't very practical. He was okay with the petroleum jelly treatment, though. So that's one of the things we still use now. But also, his older sister Sarah has eczema, so another thing we're doing is using Sarah's aqueous cream. Sarah doesn't mind, but Daniel hates using his sister's stuff. I don't want it to sound like I'm making things out to be worse than they actually are. It isn't always terrible. Some weeks are better than others, like For instance, during the school breaks, there's a definite improvement then.
Can you tell me a bit more background information about...
See what just happened. We analyzed the questions, predicted the answers, and when we listened to the audio, most of the answers were matching. That is the power of APT. For healthcare professionals taking OET, this technique will take you one step ahead. So try it, master it, and make Listening Part A work for you. Stay tuned for more such videos. Thank you.
Medcity International Academy. Trusted hands forever.